Assalamu alaikum. So welcome to all. So we who have joined today. Uh, that's good. So more than 20 people have joined. My name is Dr. Khizir. I have done the MBBS, MPhil Public Health, and full MRCEM from Royal College of Emergency Medicine. I am the faculty member of London Global Emergency Medicine Program, and that is my parent program and institute who introduced me to the MRCEM pathway. And right now, I'm working as a specialist emergency department at IMC Hospital, Lahore, and assistant professor at the Rashid Deep Medical College, and also the head of department of RF Teaching Hospital, Lahore. I have recently also got the job offer from the NHS, so I will be joining later. So, my mentor, Dr. Ishfaq Ahmed here, who is the pioneer of introducing the emergency medicine in Pakistan, and he gave the boost to the emergency medicine, that emergency medicine should be the separate department. So he is my mentor, my murshid, and he is the director of the Global Emergency Medicine. He has done the MRCEM, FRCEM, MRCP, MRCP-CH, and DGM, all the degrees related to the medicine. So we will start our session today. Our objectives, webinar objectives, that are what is the MRCEM? If you don't know, how is the emergency medicine? And then I will tell about the parts of MRCEM, eligibility for the exam, who can prepare in the exam centers preparation, the most important, worth of MRCEM in UK, worth of MRCEM in Ireland, worth of MRCEM in Gulf countries, nor the worth of emergency medicine and MRCEM in Pakistan right now. So then at the end, I will tell you about the worth of portfolio, certification, and my affiliation with the London Global Emergency Medicine and Dr. Ash, why I support him and the program. That's the important question too. So we will talk about this after the end. I will give you 5 to 10 minutes. You can ask any question, anything, okay? And I will also share my personal number. At the end, if you don't know me, you are joined the webinar, you can ask any question personally by asking on WhatsApp. So that would be our better. So, member of Royal College of Emergency Medicine, MRCEM, that have 3 parts: MRCEM Primary, MRCEM Intermediate, and MRCEM OSCE. So, MRCEM Primary and Intermediate, they are connected online. So, the exam is online and it is connected in different cities of Pakistan. Okay, like the MRCP. MRCEM SBA, that is also connected online in Pakistan in different cities. Then the third part is MRCEM OSCE. So exam is conducted in UK and India and Malaysia. So we can't go to India because of the visa issue. So we left with the 3 options: United Kingdom and Malaysia. Unfortunately, we are far behind from the India, because India has gone ahead in the emergency medicine. They have got the recognition of 3 teaching hospitals. Their training is recognized from the Royal College of Emergency Medicine. They have got the 2 centers. So you can only give the MRCEM OSCE exam in London and Malaysia. So you can become the ED specialist, emergency specialist, and emergency consultant within 2 to 3 years. I have completed all of the 3 parts within 2 years. I gave my first MRCEM primary exam in November 2022, and I then give the MRCEM OSCE exam in January 2025. So that's the span of 2 years. I completed my full MRCEM, although being a non-trainee doctor. I did not have any training other than the LGM training. So MRCEM primary exam, who can appear in the exam, where it is conducted? Anyone who has the PMD, either it is the provisional, it is the permanent. So you can appear in the exam after house job, within the house job. During the house job, you can appear in MRCEM primary exam. That's the good news for all the house officers who want to pursue for the emergency medicine. So it is conducted 2 times in a year. you can go on the Royal College of Emergency Medicine official website. You can search. Mostly it is conducted in April, May, and then September, October and November. So in these 2 months, approximately this year, it will be conducted in April. So you can appear in this exam and you can appear in October exam. How to prepare for MRCEM Primary? So I am also conducting the teaching sessions for the MRCEM Primary. We are conducting long sessions. So we revise 3 times the course in MRCEM Primary. As the Prep Expert Online Academy, I am conducting the MRCEM Primary. So syllabus anatomy that have 60 MCQs, physiology. So all the American primary that is related to the basic sciences. So anatomy is the 60 MCQs, physiology 60, pharmacology 25, and microbiology 17. So there are different session and how to prepare for American primary. You can go through on the YouTube and you can search my session how to prepare for American primary exam. Because today the most the time I will spend on the scope of the MRCEM, and that's why I am not focusing on how to prepare it. The resources, these are resources MRCEM Success. So, and you can also join the MRCEM Academy. So that's what. Then the MRCEM Intermediate. So it is also connected online in the different cities of Pakistan. And who can appear? So anyone who have passed the MRCEM Primary, that's mandatory. After that, you must have 2 years post-graduation experience. Mean if you have graduated in 2017, you can appear in 2019. So post house job 1 year, with house job you need the 2 years experience. That's not, that can be any experience. It's GP, it's medical officer, emergency medical officer, training experience, surgery experience. Whatever the experience you are, you can appear in the MRCEM exam. In the MRCEM Primary, you can appear if you have provisional PMDC, either it is permanent, either it is provisional. After having the degree, if you have got the PMDC for house job, you can appear in the MRCEM Primary. And for MRCEM Intermediate, you only need the 2 years post graduation, post house job 1 year. So it is GP, whatever you are working on your clinic, they will not ask you the proof. Just you have to mention that you are working and you can appear in the exam. Next is the MRCEM OSCE exam. Who can appear? MRCEM OSCE who has passed the MRCEM Primary and MRCEM Intermediate. You can appear in the MRCEM OSCE exam, but for that you need 2 years experience post house job. That was 1 year post house job. No, you need, and you need 6 months. And I mean, you have to just show on the papers that you are working in them. If you are working in a private hospital, most of the time you are working in different setup, you are working clinic, you can show that I am working in emergency department at this clinic, at emergency clinic, urgent care center. So that will be counted as emergency experience. They will not ask you about the proof. So, but you must be ready for it. So that is connected in London and Malaysia, 2 times in London, 3 times in London and 1 time in Malaysia. So December, January and June in London and Malaysia, September. So that's the most important topic today is about the worth of MRCEM and emergency medicine. So member of Royal College of Emergency Medicine, the MRCEM is now the world recognized qualification in the field of emergency medicine. You can work as a specialist in Saudi Arabia, UAE, UK, Ireland, and also in Pakistan right now. If anyone say that you can't work as a specialist, they are lying. They don't want to pursue in the emergency medicine. So I will tell you how you can work there. Okay. And in Gulf countries, either with in UAE, especially if they're with the American Primary and SBA, you can work as a GP specialist. That would be called as a GP specialist in the emergency department. Any question you can ask at the end, I will give you the time. Don't worry. I will answer every question. So, member of Royal College of Exam, and why it is important, because if you are working anywhere in the world, if you are working in Saudi Arabia, if you are working in UAE, if you are working in Pakistan, and you are a medical officer, you are an emergency medical officer, you are working as a GP clinic, you must go for the MRCEM because it's an emerging field and the most demanding field in Pakistan and all over the world. I will tell you that how it is demanding. That I passed my MRCEM in January. After that, I did not apply. I went to Saudi Arabia, but from after leaving the Saudi Arabia, I started to apply in October, and from October to December, I got more than 8 interviews out of 40 or 45 applications. So I got 8 interviews, and people who have done the lab, they are not getting interviews after the 1500 applications. I know the people after the 1000 applications. Yeah, if you have done the lab, so you must go for the American primary and intermediate as soon as possible. That would be good for you. I will discuss it. So that's how demanding it is. So there are many jobs at the registrar level. In Saudi Arabia, when I left the ICU job, I was offered 2 jobs as a specialist. So in UAE, this is also high demand for the emergency specialist. If you have done the full MRCAM, you can also work as a specialist, but that I will discuss that how you can work as a specialist in UAE and Saudi Arabia and the other Gulf countries. So you must complete the full MRCAM if you want to get the GMC. Yeah, if you will get the GMC, yes, you will get the GMC. Still having the MRCEM OSCE exam, you don't need any OET exam, any IELTS. After completing the MRCEM or GMC, you need the OET or IELTS. But if trust or any consultant gives you the exemption, if you have not appeared in the OET exam, have not failed the OET exam, then any consultant, any trust, they can give you the exemption from the OET, so you can get the job without having the OET. That's the special cases. Most of the time, if trust see that you have a work, you have a portfolio, you are working in emergency department, and they think that you are very competent, they need you, they can ask the GMC to give you the exemption from the OET. So if you are in the interview, they assess you. So that's the rare thing. But if you after the MRCAM, you can do the OET, you can get the GMC. That would be having the more chances to get the job. But there are many chances and exemption that you can get the job without IELTS and OET. That's true. So after having the MRCAM, you will be hired as a registrar level. Okay. Yeah, you can be hired as a junior level, but if you have experience of more than 3 years in emergency medicine or as a post house job experience, then you can be hired as a registrar. And when you will be hired as a registrar in UK, you will be get more than 60,000 pay per annum. That's a good handsome after getting the tax. You can get 4,000 per month. So that's what an extra allowance is, everything that's included. So other thing about the MRCAM, if you have a good portfolio and you are working in Pakistan and you are getting signed the competencies, mean you have done the 3 months anesthesia, 3 months ICU experience, 3 months field emergency, you have got the sign from any consultant, either it's FCPS medicine, either it's any pulmonologist who is working in the critical care and the anesthetist, they signed you the competencies and you can prove it. You have the proof that you have got the notification for working in anesthesia, peds emergency, ICU, acute medicine. So you can apply the national training program in UK at the ST3 level. That's called the dream pathway. That's a different thing. And you can also apply on the higher specialty training. That's also depends on the competency signed by the consultants. So, and you can also become a consultant by staying in Pakistan. That's also true. So we will talk about it. So you can see if I will answer every question at the end. Okay. So you can see that I just applied to show you the people that if you have done the MRCAM, you can be classified as an emergency medicine registrar. Okay, so that's my eligibility. I am eligible to become a registrar, but if you have post MRCAM 2 my CV. So you can see that I have, these are my achievements: specialist training, completed CCPM certificate program, 240 CME hours, NHBM and I have done the MPhil Public Health, ACLS, BLS, OT, focus level, advanced trauma life support. So all of these courses I have done, and teaching international faculty members, so research and publications, communication. So you can see MRCEM, Master MBBS, ACLS, CCPEM, point of care, critical care, whatever the course I get, I go for it. I don't see. So spend the money on your education and skills. You will get back in 10-fold time. Okay. So that's why it's important. So that's my professional experience working as an integrated medical center, specialist emergency medicine, then attachment. I just did it because I was there in UK, so I did it. So that's what not important. Staff physician, ICU registrar, clinical instructor, senior medical officer, ICU, then the emergency. So where I was working, THQ level hospital, I got because I was working in both emergency and OPD beds, but I got the experience as emergency medical officer. So that's how you can also get. You have to just get signed from the consultant. So you must be prepared for. I just started to prepare my experiences when I started my MRCEM journey. If you are starting now, you must get experiences of the emergency, so that will have a more worth when you will apply for the job. Because most of the time in private hospital we are working in IPD and emergency, we are rotating, but you can get the experience of. So that's how I got the Latif Hospital as emergency medical from the consultant, and TH Hospital, Chowkidam, Hamida. So that's how I made all the experiences. That's my house job. Then assistant director, visiting physician in Coca-Cola. So that's all. And teaching experience, I have done a lot of teaching. That international faculty member, co-instructor of London Global Emergency Medicine. And so all these things, teaching experience should be on your publications should be, they are, I have mentioned only few certification, but I have a lot of. Okay, so they are, I recently published as a first author too. So these are my publications, more than 5, 4 audits and quips. I did these audits and quips with the help of London Global Emergency Medicine. These are my core competencies. I have done airway, EMR. So these are focus level, intubation. I can do all of the procedures. So these are my certifications: trainer, instructor, certificate training, point of care, workshop, course, webinar, lecture. So these are all, and then you must need the leadership skills. And the other thing, you must need the presentations, audit, scripts. So all these things should be on your CV. Then you have a great chance to get a job. So now we will come on the questions. Yeah, any question you can ask. So I have my CV was made from the Prestige pathway. I think what's that, and for CV making, I can give you the number for that, but that for Ireland and for other than NHS, you don't need a CV. Okay, yeah, you need because you have to fill online. For but Ireland, you need the CV. You need CV for Ireland. You have to upload for Saudi, for Dubai, so you can connect with this person for CV. So he is a professional CV maker. He made my CV. So any question? So I will go to the question. You can ask any question. So is there some hands-on experience required for MRCEM OSCE? Yeah, definitely. You must need MRCEM Primary login. So yeah, it is possible that you can get the job. I know Dr. Rahmat. He is from LGM. He got the job. Last month he was the best uh, GP and that hospital. He is our LGM trainee. So yes, it is possible, but for GP ship, you have to get the ICAMA. You can go there and you can transfer because they are not offering ICAMA to the GP. Like the UK, people uh, want the junior level doctors, but they are restricted from the Interior Ministry to give the visa. So that's why they are not giving job. If you are there, so you can get. I don't know which post we can apply for Gulf countries. You can apply for the GP emergency medicine. Can you please reference of career in Ireland? Yes, I have explained, Dr. Hogwarts. Yeah, I have explained it's very important. Sir, with MRCEM Primary SPA possible? Yes, GP emergency medicine. You can work in UAE. You can also work in Saudi Arabia. That's there are high chances. Scope of MRCEM. Yes, I have explained, Dr. Iman, that you can get as a specialist job in Saudi Arabia after doing the MRCEM. And with MRCEM Primary Intermediate, you can get the GP. Self-regulation law effect training pathway after MRCEM. Yes, that would affect everything, but you don't, because for MRCAM you can become a consultant with the Caesar pathway. That's very important. You don't need to get the training. And Alhamdulillah, right now I am not trained, got the conventional training in Pakistan, but I can say that I am better if you are working in a best emergency, like I worked in here. Right now I am MC. These are very best emergencies, and Ashifa emergency, Agafa emergency. So these are well-established emergencies, like in Multan and Mukhtar Sheikh, because that is being leaded by the emergency consultant. So you can become a very good emergency physician without training. So you can become a good emergency consultant in NHS with the Caesar pathway without joining the conventional training. No, you need a GMC. But if you have a more than 10 year, 20-year experience, yes, you can get the job. But, okay. So what about the entering ST training in UK after? Yes, you can. Yes, there is a dream pathway, Hamzala, dream pathway and headspace. But dream pathway you can get to, that's very easy. And then if you are have worked more than 2 years or 1 year in, then you can go to the higher special training. You don't need strong CV as strong as yours. Can we get some job after primary in Pakistan? Yeah, that would be medical officer job, Dr. Aisha. If you have not registered on a PMDC, you have not done the MRCAM, you will get the medical officer job. Yes, you can. We need to be working in the hospital to get the competency sign. Observation does not count. Yeah, you need to be working for a company. If you want to stay in Pakistan and become a consultant by staying in Pakistan after doing MRCAM, yes. GP considered किया जाता है as a specialist level of qualification, as a specialist. You will be considered as special level 3 qualification. There are a lot of jobs for emergency medicine. Right now I have got the job offer. I'm not applying, but there are a lot of jobs I can see, and I have applied more than 120 jobs. In last 2 months I have applied more than, and I got the job within 45 applications. So I'm not appearing in interviews. That's why. And by from two, but I got my degree. So any question like that, like AZ, double I. So I'm not getting your question. You can text me. I will. So I am sharing my number. If when people don't have my number, can text on WhatsApp. Please WhatsApp. Don't call. Don't do calls. To complete full American, is there a time limit? No time limit. Can be done by staying back in. Yeah, you can become, if you are Ibrahim from LGM. Yes, you can become an African consultant if you don't want to go there. Yes. Would you please post the recording of this session? Yeah, we will post it. That will be available on my social media and also the prep expert everywhere. So that will be so, okay. I think we are going to end this session. Any question? Okay, thank you very much to all. Yeah, in WhatsApp, everywhere you will get it. Don't worry, you will get it. You can follow us on everywhere. Okay. Okay. Thank you very much. Allah Hafiz to all.